When we experience something deeply distressing, like witnessing a traumatic event, it can stay with us in ways we don't expect. One of the hardest symptoms? Intrusive memories. These are vivid, unwanted mental images that pop into your head, often out of nowhere. For many healthcare workers during the COVID-19 pandemic, these moments weren't just tough, they were haunting. But what if there were a simple and fast way to help reduce those disturbing flashbacks? A team of researchers in Sweden decided to test exactly that. They ran a study with 144 healthcare workers who had experienced work-related trauma. Each participant was dealing with at least 2 intrusive memories a week. The goal? To see if just one guided session using a specific memory technique could help. The technique was surprisingly simple. First, the participants thought briefly about a distressing image from their trauma. Then, they played the game Tetris for 20 minutes, but with a twist. They had to mentally rotate the blocks before placing them. Sounds odd, right? But there's science behind it. When we imagine and manipulate images, like rotating Tetris shapes in our minds, it uses the same parts of the brain involved in visual memory. By doing this right after recalling a traumatic image, the brain's memory reconsolidation process can actually weaken that image's intensity. It's a bit like replacing a strong, painful memory with a less vivid version. Participants were split into 2 groups. One got the Tetris intervention. The other did something neutral, listening to a podcast about philosophy. After 5 weeks, the results were clear. The group who used the Tetris method had about 70% fewer intrusive memories compared to the podcast group. That's a huge difference for such a small investment of time. But it didn't stop there. The Tetris group also showed less post-traumatic stress and distress for up to 6 months after the session. And the best part?
The method was delivered remotely on the participant's own smartphone. That means it's easy to access, private, and can fit into even a busy healthcare worker's schedule. This study shows that we don't always need long therapy sessions to make a difference. Sometimes, even one carefully designed session can bring real relief. Of course, this isn't a full treatment for PTSD, but it can be a powerful first step, especially for people who may not be ready or able to start traditional therapy. And maybe, just maybe, science-based tools like this can help make healing more accessible and immediate, especially for those who give so much to help others.